Without a doubt, I believe that one of the most important contributions that early learning programs make in supporting the development of young children is in the area of social-emotional development. We're very focused on school readiness, which is wonderful, but oftentimes we're so much more focused on the academic aspects of school readiness, and we do not place as much of a value or emphasis on the social-emotional aspect. And it is really critical for children to be able to stay focused, to follow directions, to be able to get along with other children in order to learn and therefore acquire those academic skills that we so very much believe are important for the success in school and in kindergarten. A quality early childhood program, from a child care center to a Head Start program, provides a wonderful opportunity for children to experiment on those newly acquired skills of expressing their emotions in an appropriate way, getting along with their friends, expressing their needs with caregivers and adults and do so in a safe and nurturing environment. Many times children do find those opportunities to practice. They're able to do so successfully, but other times, for a myriad of reasons, children may struggle on appropriate ways to manage their emotions, and we end up seeing children in childcare settings that are aggressive, that instead of using their words when they want a toy, may opt for less appropriate options such as biting and hitting and throwing. So we may see from that extreme to the other end of the spectrum children that may be suffering from depression or withdrawal. In our programs we see kids from such diverse background and children that may have experienced some traumatic events in their life. Putting all those pieces together is what early childhood mental health is, and equipping kids with skills that can help them begin to make sense of their world that sometimes is in a state of chaos and turmoil.
So we're learning more and more from neuroscience about the impact that things like trauma and chronic stress can have on a child's brain development. So it's become one of our program goals to help the community at large be more trauma-informed, so that early childhood educators can really create a positive and nurturing environment for children. Because what we also know from neuroscience is that things like a nurturing relationship and positive environment can have a positive impact on brain development. It's become one of our goals to be more trauma-informed through all levels of care, from our prevention services up through our treatment services. We have a team of clinicians who's trained in trauma-focused cognitive behavioral therapy so that they can really work most effectively with these young children who have trauma histories. My son gets treatment once a week at school, so they come and help him, and my son has behavior issues, so they're working with him to manage his anxiety and his anger and things like that, and teaching the teachers how to help him, because he does need a little more and different help than the other kids in his class. And then his father and I are taking the Triple P class, which is how to help a strong-willed, defiant child with everyday things like trying to get him to eat and listen to rules and things that we want him to do that he should be doing. His improvement, he's been getting the classes at school for probably about 6 or 7 weeks now, and then we're in the 5th week of our parenting class, and for the last 2 or 3 weeks he's been amazing. It's just the little technique of how to tell him to do something has just been so helpful, because he responds even the next day. It was just changing what we say, and it was perfect. It was awesome. So the last couple weeks have been so much better. And I'm so thankful and so happy, because we haven't had such chaos in the morning and the evenings and the weekends, which is really nice. There are so many parents out there who need help. There's so many kids out there that need help. And instead of waiting until they're 16, when they're so out of control you can't do anything about it, I would just rather get it, okay, let's figure what it is now, and we'll work on it now so that in 10 years or 15 years, it's not a huge problem.